Hello and welcome to this touch base. I hope your studies are going well. The exam is just about 2 weeks away. I apologize for the video. I'm not sure why my videos are not showing up. My camera seems to have just died on me, and so there's no faces on the top there. So I apologize for that, but you can still hear me, so we'll just continue. So we're going to review a couple of these chapters today. And, I won't go over all of them, but I will go through some chapters that I think as a pharmacist that we can have a major impact. I did get these questions from a couple of colleagues of yours. So one, is there going to be a lot of emphasis on statistics? And how familiar should we be with things like carbohydrate ratios and insulin ratios and stuff like that? So the answer to that is that, for one, yes, there's going to be a lot of statistics on the exam. That's why I have a statistics cheat sheet for you to memorize. There's also a quiz on that as well. You should go to the full quizzes section, and then you'll be able to just test yourself on these parameters until you do well. Now, for the insulin ratios and stuff like that, there seems to be less and less of that on the exam. They seem to focus less on insulin titration. So I wouldn't actually memorize this cheat sheet. This one I would, but for this one here, I wouldn't. However, I do think it's really important for real life practice that you understand how those calculations work. So just have this ready for real life practice. So let's look at a couple of the chapters. So for diabetes and driving, I think it's important for the exam and in real life to remind patients not to drive for at least 40 minutes after having an episode of hypoglycemia. Once people have a little bit of sugar in them, they start to feel better and they think they're a-okay to drive again. But lots of studies have shown that their reaction speed is significantly affected by hypoglycemia, it's significantly slowed. And some test subjects took 40 minutes to recover their reaction speed, so quite a long time. Something that you could do is you can order DEX4 samples for your truckers, Uber drivers, bus drivers, etc., who are patients. And you can do that through the dex4.ca website. So you can order samples here. And once you're a CDE, you can say that you are a diabetes clinic and order samples. They limit the amount that they supply you based on the size of your clinic. So if you have other CDs in your pharmacy, you can add that in and they'll give you more samples. But because the supply of these are limited, I like to kind of reserve these for drivers and other people who are at high risk of hypoglycemia. They come in packets just like this. And, it's important to remind patients that they need 15 grams of fast-acting carbohydrate. Often patients will take 1 tablet or half a tube of glucose gel or a quarter of a juice pack, and that's just not enough. So remind them to take the full 15 grams. For DEX4, it's 4 tablets for 15 grams of carbohydrate. That's why it's called DEX4. Emphasize the 4 to them. Also, it comes with this nice coupon in there as well, so patients like that. For chapter 23, it's important to memorize the ABDESSS and how to implement them with patients. That's right here. This is in my study guide. And, there always seems to be questions on these on exam. So for the A1C targets, you should have them memorized by now. If not, use the targets quiz again and again until you hit 90%. You should know the targets for blood pressure. For cholesterol, same thing, you should know the targets. For D, you should be aware of which medications have demonstrated cardiovascular benefit. And which ones have renal, and I would say which ones have renal benefits as well. For E, for exercise, we've already discussed a number of ideas. You should have those already. For screening, you should have that again memorized. Please see my cheat sheet for that as well as my full quiz. For smoking cessation and stress management, you should know how to set SMART goals as well as Prochaska's stages of change. Also, for quitting smoking, you can go to nicorette.ca and see which if your province covers nicotine replacement therapy. Just in my own experience, I've found NRT to be quite effective for patients. There's also lots of options for them. There's gums, there's lozenges, there's sprays, there's inhalers. So just experiment with your patient, experiment with those of your patients, see something that's what works best for them. As a prescriber in Alberta, I've also prescribed Zyban and Champix, and they both were well, but in my opinion, I found Champix to be more effective. Quitting smoking is a significant health benefit that, as pharmacists, I think we can really help facilitate. And if you're looking for something else to tackle after the CD exam, there's also the Certified Tobacco Educator exam that will give you additional training in helping patients quit smoking. So there always seems to be a question on the ABCDSSS on the exam, and also on the algorithm for cardiovascular protection. So that's this one right here. And so it's important for this that you're going from top to bottom. It's not designed to go from bottom to top. You want to go top from bottom. And you should have this memorized for the exam. There always seems to be a question on this on the exam as well. This is not on the exam, but there's lots of different cardiovascular risk calculators that can help a patient decide if they want to be on a statin or not. So this is from cvdcalculator.com, or Best Science Calculator. And you can see, oopsies, here, there we go. And you can see here that you've got, this one's based on the Framingham, and you've got these 100 smiley faces here. Each smiley face is a 1% chance that you won't get, or your patient won't have, a cardiovascular event in the next 10 years. You can see that there's green ones, there's kind of pink ones. Those are due to not modifiable risk factors, so things we can change. And the dark red is due to things we can't change, such as age and gender. So you can see that, for a 40-year-old female, no smoker, no diabetes, their risk is quite low. But you can change it around here. And so here's a 60-year-old male, but just by adjusting these things over here, and a smoker and diabetes, and you can see that this guy has a 60% chance of having a cardiovascular event in the next 10 years. So a very high chance. And so you can talk to them about these benefits in the middle here. You can choose one of them, such as you can click on them. And for, say, statins, you can show that, okay, Mr. Smith, if you go on a statin, you will reduce your risk of having a cardiovascular event by this much. The dark green smiley faces are the ones prevented, or represent cardiovascular events prevented by the intervention here in the middle. So this is something that can help, convince your patients to see that, oh, wow, I actually get a very big benefit here. And that's why I should go on a statin. Even though on the internet, patients will read, oh, it causes muscle stiffness and dementia and blah, blah, blah. You can show them this here and show that, hey, there's a real cardiovascular benefit from starting a statin. So for the dyslipidemia chapter, you should know the targets and be able to discuss the benefits of a statin. Sometimes discussing cardiovascular age can help. When I tell someone that, hey, you've got the you're 40 years old, but you've got the cardiovascular age of someone who's 60. Then they're like, oh, geez, that's not good. I should go on this statin to reduce my cardiovascular age. So there's different risk calculators that show different things. It's nice to be familiar with them so that you can show them to your patients and help them to decide if they want to be on a statin or not. This is not on the exam, but there is a updated Canadian cholesterol guideline that just came out last year, and it's really interesting. It's got guidance on how to monitor, how to test for things like genetic factors. You can test for this one genetic factor once in a lifetime because your genetics don't change, but it really can guide people in putting you, oh, you're actually in a higher risk category, or oh, you're in a lower risk category. They've also got stuff on Visipa and what to do if the triglycerides are high. So yeah, very interesting stuff. It's not an exam, but eventually I'm going to put a summary of it in my how to use your CDE section. So yeah, just check it out once you have time and after the exam. So for blood pressure, you should know the targets, and you should also know the blood pressure, how to use a blood pressure meter and its technique. I have so many patients who say they're getting these erratic blood pressure readings. And when I asked this one gentleman to come in to kind of check how his blood pressure was, and I asked him, show me how you take your blood pressure at home, he laid down on the floor. And I'm like, sir, what are you doing? And so, and I've had other patients, they've got a sensor in the cuff the wrong way, so they're taking their blood pressure through the elbow or some other craziness. So, it sounds like blood pressure meter technique is common sense, but it actually isn't. And so it's really important to go through that with your patients when they're buying a blood pressure meter or when they're monitoring their blood pressure for hypertension or for cholesterol or for whatever. Okay, you should be able to review the benefits of ACEs and ARBs with them, both in real life and exam, and check their compliance with these medications. There's also some really cool resources and salt calculators. This one is made by the University of Ontario, and you just kind of fill out this quiz, and it calculates how much salt you're taking in, and has lots of suggestions on how to reduce sodium intake for your patients. The Heart and Stroke Foundation also has a lot of recipes and great ideas to reduce your patient's sodium intake. For chronic kidney disease, remind patients that good blood glucose control can help prevent and delay kidney disease. Otherwise, all the diet and lifestyle measures to keep the kidneys healthy are the same as diabetes, such as keeping active, eating healthy, getting sugars to target, get blood pressure to target, get lipids to target, etc. And there are some studies now that show SGLT2 inhibitors can significantly preserve renal function. And so this is kind of a matter of debate in some other countries' guidelines. Some other countries are thinking of kicking metformin out of first place and replacing it with, GLP-1s or SGLT2s because they have these significant cardiovascular and renal benefits. For your exam, keep saying metformin is first line, but that might change eventually. For retinopathy, remind patients to get their eyes checked regularly and to mention that they have diabetes so that the provider looks for diabetic retinopathy. Some people go to an eye exam, they don't mention that they have diabetes, they expect the optometrist to be able to mind read them, and they don't get a check for diabetic retinopathy. So it's make sure your patients mention it. This is a nice pamphlet that you can give to patients. It's just in my chapter study guide. You can just slip it in with their medications, and it gives a nice summary of how diabetes affects the eyes, what it looks like, why you should get it eye exam, how to do it, and how often to do it. So this is a nice thing just to, if you've got a patient who's wondering about that, just slip it in to their medications. Okay, foot care. So when you're dispensing medications, you can mention something like, hey, did you know that foot problems are common in people with diabetes? Have you noticed any numbness, tingling, or any other issues? And it's just, you can just bring it up. You might not do the foot screen, but it's important to mention to patients that, diabetes does put you at higher risk of having, foot ulcers and nail fungus infections and things like that. So the Diabetes, Obesity, and Nutrition SCN has absolutely excellent resources for understanding and how to perform a foot screen. That's just right here. You just go to Alberta Health Services /SCNs, or just Google the DON-SCN. It should come up with this webpage. This is an excellent website done by Kathy Dimitrak, Melanie Mainville, and Petra O'Connell, and many others. And they have lots of resources here, like this video that shows you exactly how to do a foot exam. It's a good visual, so you can see what exactly you're looking for. They've also got a guide of what to look for and an e-learning module that's absolutely free. So really, really practical resources that I think you'll find useful. Yeah. Oh, I also forgot to mention this in my last presentation. For the weight management chapter, there is actually a website where if they've been prescribed Contrave, you can get your patients the first month's supply at no charge and financial assistance as well. So just something, an added value item that you can do for your patients. Oh, please. Okay, so yeah, in conclusion, as usual, I feel that there are several impactful interventions that you can do for your patients in a pharmacy setting. Reminder that the exam is 2 weeks away, so if you should be well on your way for studying. The Q&A with myself is scheduled for May 25th. Just go to the 2022 Q&A webpage for all the details and Zoom links and stuff like that. And any questions? Okay, looks like there's no questions. I hope you have a wonderful day and best of luck studying.